ਹੈਲੋ ਹਾਂਜੀ ਵੈਲਕਮ ਕਰਦੇ ਹਾਂ ਤੁਹਾਡਾ ਸਾਰਿਆਂ ਦਾ ਨਰਸਿੰਗ ਕਰੀਅਰ ਚੈਨਲ ਦੇ ਉੱਤੇ। ਸੋ ਕਾਫੀ ਇੰਪੋਰਟੈਂਟ MCQ ਨੇ ਕਮਿਊਨਿਟੀ ਹੈਲਥ ਆਫਿਸਰ ਦੇ ਐਗਜ਼ਾਮ ਲਈ। ਚਲੋ ਸਟਾਰਟ ਕਰਦੇ ਹਾਂ ਫਸਟ ਕੁਐਸਚਨ ਦੇ ਨਾਲ। The term thrombocytopenia means, so what is the meaning of thrombocytopenia? A weakness of platelet aggregation, low platelet count, increased platelet count, normal platelet count. So term thrombocytopenia means it's a low platelet count. When low platelet count is called thrombocytopenia. Option B. Second, which of the following is a bleeding disorder? Leukemia, anemia, hemophilia, sickle cell anemia. So hemophilia is a bleeding disorder. Option C is the right answer. Third, saliva contains an enzyme that acts upon which of the following nutrients? Option A, protein, fat, starch, minerals. So saliva contain an enzyme that act upon which of the following nutrients? Starch. Option C. Next, fourth, the rate of drug absorption is greatest in the large intestine, stomach, gallbladder, small intestine. So rate of drug absorption is greatest in the small intestine. Option D. Next, fifth, which of the following bone is called collarbone? Acetabulum, pelvic, scapula, clavicle. So clavicle is also a collarbone. Option D. Next, sixth, which of the following is the master gland of endocrine system? Pancreas, pituitary, thyroid, adrenal. So pituitary is the master gland of endocrine system. Option B. Seventh, which of the following allows air to passes into lungs? This is very easy question. Which of the following allow air to pass into the lungs? Aorta, esophagus, heart, trachea. So option D, trachea allow air to pass into the lungs. Option D. Eighth, the membrane that speaker's auditor canal from middle ear is called eustachian tube, tympanic membrane, labyrinth, pinna. So membrane that speaks auditor canal from middle ear is known as tympanic membrane. Option B. Ninth, in the demographic cycle is highly stationary stages, high birth rate and high death rate. The death rate begins to decline while the birth rate remains unchanged. C, death rate declines still further and birth rate tends to fall. Last, low birth and death rate. So in the demographic cycle is highly stationary stage is high birth rate and high death rate. So option A is the right answer. Next, 10th, maternal mortality rate is expressed in the terms of per 1000, per 10,000, per 1 lakh, per 10 lakh. So the right answer is maternal mortality rate is expressed in the terms of 1 lakh, per 1 lakh. Option C. Next, move to the 11th. In India, high birth rate is due to of the following reason, but except. So in India, high birth rate is due to of the following: early puberty, universality of marriage, early marriage. All are high birth rate, but except high level of literacy. So high level of literacy is not included in a high birth rate. So option D is the right answer. Next, 12th, the ratio of number of pregnancies in a year to married women in the age of 15 to 40 years is called gross reproductive rate, pregnancy rate, marriage rate, fertility rate. So ratio of number of pregnancy in a year to married women in the age of 15 to 44 years is called pregnancy rate. Option B. Next, 13th, the constant presence of a disease or an infectious agent with given geographical area is called pandemic, epidemic, endemic, sporadic. So endemic is the right answer, option C. 14th, the person, animal, object or substance from which an infectious agent passes or disseminated to the host is called reservoir, source, carrier, latent infection. So the person, animal, object or substance from an infectious agent passes or it disseminated to the host is called source, option B. Next, 15th, when two live vaccines are required, it should be given at simultaneous at different sites, simultaneously in the same site, both together as IV, and all of these. So when two live vaccines are required, it should be given simultaneously at different sites. So option A. 16th, when antibodies produced in one body are transferred to another, induce protection against disease is called active immunity, herd immunity, passive immunity, cellular immunity. So when antibodies produced in one body are transferred to another to protect against disease is called a passive immunity, option C. Next, 17, episiotomy has to be done during first stage of labor, second stage of labor, third stage of labor, none of these. So second stage of labor episiotomy is done, so option B. 18, a woman who never given birth to a child, it's known as nullipara, nulligravida, primigravida, parturiente. So woman who never given birth to a child is called nulligravida, option B. 19th, increased pigmentation in the face during pregnancy is called linea nigra, striae gravida, chloasma, caput medusa. So increased pigmentation in the face during pregnancy is called chloasma. So option C is the right answer. Next, 20, the thin serous fluid secreted from breast during first 24 to 48 hours is called foremilk, hindmilk, colostrum, all of these. The thin serous fluid secreted from breast during first 24 to 48 hours is called colostrum. So option C is the right answer. Next, 21, the essential obstetric care provided under RCH phase is all of the following but except early registration of pregnancy, provision of safe hospital or home delivery, provision of 3 postnatal checkups. So but except the right answer is provision of minimum 10 antenatal checkup by ANM or medical officer. So it's not included in under RCH phase. So option B. 22, benefits of kangaroo mother care, all of the following but except improve mother baby bond, increase milk production in mother, and keeps baby warm. So all are the benefits of kangaroo mother care but except increase infection in children. So option C is the right answer. 23rd, a pregnant woman should visit the antenatal clinic twice a month during which of the following month of pregnancy? 6 months, 7 months, 8 months, 9 months. So pregnant woman should visit the antenatal clinic twice a month during which month of the pregnancy? 8 month of pregnancy. So option C is the right answer. Next, 24th, at 20 weeks of pregnancy, uterus fundus is palpable at abdomen, lower border of umbilicus, just below hyphistrum, at the level of axifistrum. So 20 week of pregnancy, uterus fundus is palpable at lower border of umbilicus, option B. Next 25th, the immunoglobulin which protect the newborn against enteric infection is IgA, IgD, IgG, IgM. So hemoglobin which protect the newborn against enteric infection is A, IgA. Option A is the right answer. Next 26th, the route of administration of DPT vaccine is intradermal, subcutaneous, intramuscular, intravenous. So route of administration of DPT vaccine is intramuscular. Option C. 27th, in children with diarrhea, the main aim of ORS therapy prevent dehydration, reduce mortality, to get water and electrolyte deficit, all of these. So in children with diarrhea, the main aim of ORS therapy is prevent dehydration, reduce mortality rate, to get water and electrolyte deficient. So the right answer is option D, all of these. Next 28th, the most preferred vaccination site for hepatitis B vaccine in infants is intradermal, vastus laterals, intravenous, central venous catheter. Most preferred vaccination site for hepatitis B vaccine in infants is vastus lateral, lateral aspect of thigh. So option B. 29th, weekly iron and folic acid supplementation program is meant for. So weekly iron and folic acid supplementation program, adolescent girls and lactating mothers, adolescent boys, pregnant mother and lactating mothers. Next C, pregnant women. D, adolescent boys and girls. So weekly iron and folic acid supplementation program is meant for adolescent boys and girls. Option D. Next 30, the adolescent health program provide iron and folic acid supplementation on all days, fixed days every week, once a month, once every 2 months. So adolescent health program provide iron and folic acid supplementation on fixed day every week. So option B is the correct answer. Next 31, to maintain a hepatitis of adolescent and for control of Helminth's infection, tablet albendazole is administered once a year, twice a year, 3 times a year, once every 3 months. So to maintain hepatitis of adolescent and for control of Helminth infection is administered twice a year. Albendazole tablet is administered twice a year. Option B. 32, the only way to limit the size and control the interval between birth is by reducing maternal mortality, family planning, health counseling, all of these. So only way to limit the size and control the interval between birth is by family planning. Family planning is the best method. So option B. Next 33, National Vector-Borne Disease Program cover the following. So National Vector-Borne Disease Program cover malaria, chikungunya, Japanese encephalitis, but except leprosy. So leprosy is not included in National Vector-Borne Disease Program. So option B. Next 34, measles is caused by varicella zoster, RNA para, myxovirus, rubella virus, influenza virus. So measles is caused by RNA para myxovirus. Option B. 35, in following which disease caused by varicella? Diphtheria, leprosy, syphilis, chickenpox. So which disease caused by varicella? It's a chickenpox. Option D. Next 36, when the diarrhea lasts for more than 14 days, it's called dysentery, acute water diarrhea, persistent diarrhea, all of these. So when the diarrhea lasts for more than 14 days, it's called persistent diarrhea. Option C. Next 37th, a 5-year-old child is admitted in hospital. The best nursing action for parents who are displaying anger and guilt is A. Give personal example that are similar to their situation. B. Distract their attention to something less painful. C. Explain the dangers of excess anxiety and guilt. D. Anticipate their emotional response. So the right answer is option number D. Anticipate their emotional responses and acknowledge them. Option D is the right answer. Next, 38. When a child is acute phase of nephrotic syndrome, which of the following is essential measure the nurse should take? Urine dipstick to be done every 1 hour, measure abdominal girth every 2 hours, check the hematocrit value every 12 hours, weight the child daily. So when a child is acute phase of nephrotic syndrome, so measure is weight the child daily. Option D. 39. Which of the following is the early finding nurse should accept to observe if a patient were to develop thrombophlebitis following an intravenous infusion? Mottling and coolness, arrhythmia and heat, leakage of fluid and numbness, pallor and swelling. So, early finding nurse should accept to observe if a patient were develop thrombophlebitis. So, check the arrhythmia and heat and following the intravenous infusion. So option B is the right answer. Next, 40. Under the WHO Vision 2020 program, the safe strategy is adopted for which of the following disease? Trachoma, glaucoma, diabetic retinopathy, onchocerciasis. So the right answer is option A. Trachoma. WHO Vision 2020 program, the safe strategy is adopted for trachoma disease. Option A. ਸੋ ਇਹ ਇੰਪੋਰਟੈਂਟ ਕੁਐਸਚਨ ਸੀ ਜਿਹੜੇ ਕਮਿਊਨਿਟੀ ਹੈਲਥ ਆਫਿਸਰ ਦੇ ਐਗਜ਼ਾਮ ਲਈ ਕਾਫੀ ਇੰਪੋਰਟੈਂਟ ਰਹਿਣ ਵਾਲੇ ਆ। ਸੋ ਵੀਡੀਓ ਨੂੰ ਐਂਡ ਤੱਕ ਜ਼ਰੂਰ ਦੇਖਿਓ ਅਤੇ ਚੈਨਲ ਨੂੰ ਸਬਸਕ੍ਰਾਈਬ ਵੀ ਕਰ ਦਿਆ ਕਰੋ। ਓਕੇ ਗਾਇਸ, ਮਿਲਦੇ ਹਾਂ ਨੈਕਸਟ ਵੀਡੀਓ ਦੇ ਨਾਲ।